But clearly we're dealing in a situation where over the last 6 weeks, we have not received the supplies we would hope. So to date, we've given about 560,000 doses, both first and second combined in the state. So I'm leading the efforts for MHealth Fairview, not just Southdale, but for the entire Fairview health system. And we've given about 60,000 of those 560,000. So a little more than 10% of the state's doses have been given by Fairview. Right now, the supply is being managed by both health systems and local public health. Those are the folks that are doing the vaccinating. And one of the challenges that we've had is the government determines how much Minnesota gets, and then Minnesota, the Department of Health, determines how much local public health and each of the health systems get. And we've been finding out typically end of the week, like on Friday, what we're going to receive the following Tuesday. And then there's an expectation to give all those doses within 72 hours. And one of the challenges I think we're all having, whether you're Edina, Fairview, Health Partners, is when you give a bunch of doses in a 72-hour period, 3 weeks later, you have to do the same administration for dose 2. But those are also the days that you're also giving dose 1 that you've received to new people. So you've basically doubled the volume of people you've got to see in a given day. So that's really going to stress some of the clinics where we're administering vaccine, unless the state can help us figure out how to spread it out a little bit better. Right now, most are vaccinating the remaining healthcare workers. There's still an estimate of 10 to 15,000 just in the metro area, and those would be our dentists and our optometrists and our chiropractors and others. Most health systems right now are currently vaccinating 75 and older, and a few are doing 65 and older by invitation. So basically getting a MyChart or some other invitation out to a select group based on supply. So my best recommendation for everyone is to, no matter where you get your health care, I think virtually every organization is up on Epic except Children's. So I would encourage folks, if you don't have a MyChart account with your healthcare provider, to create one and make sure it's updated with all your preferred sort of contact or notification information, because that's very likely how everybody's going to get contacted when it's their time to be able to receive a vaccine. So far, seen a very good safety profile, very, very, very few serious reactions. In fact, our employee health nurses have commented that it seems like we're seeing fewer reactions than we do in a typical influenza season with the flu vaccine. So I think I'm going to pause there because I really have very little time per Margaret, but I would, again, be very happy to do just a separate 1 hour time if people want to gather at 5:30 or something someday and do a more in-depth one and talk about that. I guess the only other thing I would stress too, just because I think it's not very well out there in the media, is the vaccine does take time to work. We've even noticed that healthcare workers think in some instances that it offers immediate protection. The first dose does offer some good protection, but it's not until 1 week after the Pfizer or 2 weeks after the Moderna vaccine that they've studied the actual efficacy, and it's 94 and 95% at that period of time. And even after that period of time, it's still important to wear masks and respect social distance to help prevent.